Ready? 1, 2, 3.
Three, two, one.
3.
People are really having fun with it. You can never see that enough. Well, here's why we're doing all this. No doubt you've seen the videos all over social media. It seems like everyone's taking the ALS Ice Bucket Challenge, but this morning we're talking about the serious effects of ALS and how to know if you are at risk. It is often regarded to as Lou Gehrig's disease, and here to talk about it some more is Dr. Bryan Ludwig from the Premier Health Clinic Neuroscience Institute. Bryan, thanks so much. We appreciate it. A lot of people having fun, and it has worked. I mean, the amount raised is, well, 10 times more than just a year ago for ALS. Let's talk about this disease. What is happening inside the person's body who has this?
So ALS is a very complex disease, but to boil it down, the best way to describe it is that the nerves that directly speak to the muscles are no longer working the way they're supposed to.
Very painful, right?
Actually, ALS tends not to come with a lot of pain. Many of the symptoms begin with weakness, and usually the weakness affects the person's legs first and then sort of spreads throughout the body.
I guess what I've heard a lot is frustration. The people that have this are very frustrated because they kind of lose control of their body as they once knew it.
That's right. Unfortunately, that's exactly right. The progression of the disease, it tends to, again, affect the limbs, but then spreads more systemically, as we say, which involves swallowing, breathing, and things we take for granted every day they're unable to do.
Very cruel disease. Who does it affect? Who can get this?
It affects mostly adults, but it doesn't really discriminate between ages. It can happen in younger and even older folks as well. It is spontaneous most of the time, meaning people develop it and there's not a real solid background on why they might have developed the disease, although about 5 to 10% of patients do have a family history or genetic predisposition to the disease.
But for the most part, it is not a hereditary thing, but just it could happen to anybody. Is there a particular person that's at risk, like a smoker or someone that lives in a certain environment or climate?
A lot of research has looked at that, actually, and smoking has been somewhat linked to the development of ALS. However, it's not a significant risk factor. Not enough is known about it, quite frankly, and we see, again, spontaneous cases, and we try to link things to it. But unfortunately, or I guess fortunately speaking, there's about only 6,000 cases diagnosed in the U.S. each year, so there's not a huge group to study.
All right, all these ice bucket challenges that we're seeing, the money is going to a good cause to research. Yeah. What do you think needs to happen in the research? What kinds of things are they looking into to try and find a cure?
Well, ALS does affect the nerves, which are a type of cell, and it's very complex. So the reason that research is so important is it's a little bit like trying to decipher your computer without the manual or without the help desk.
Right.
And you'd have to then sort of search through all the different programs that it's trying to do on a day-to-day basis to make itself work. Well, the cells are very complex, much like a computer, and we have to go through each different process that they do to attempt to figure out which one may be going wrong with this particular disease, and it's a very labor-intensive process.
Finally, is this disease curable?
At this point, no. There is medications that we can try that will slow the progression, but they will not cure the patient. Unfortunately, patients that succumb to this disease only have a few years in which it affects them, and then it takes their life. It's very, very sad, and this is why research is so important, to try to look for that cure.
Dr. Bryan Ludwig, thanks so much.
Thank you.
Good information.
Thanks,
this is why we're doing all these ice bucket challenges for this very serious and real disease. We'll have much more information on ALS on our website, fox45now.com, and just click on Fox 45 in the morning. Bryan, once again, thanks so much.